Everyone now needs to understand the spread of COVID-19 is real in the state of Texas.
It's not quite another shutdown, but a jump in coronavirus cases has the governor taking action. Today, we will tell you what he's decided for the state of Texas. Good afternoon. Thanks for joining us here at 4:30. I'm Robert Hadlock.
And I'm Sydney Benter. You just heard from Governor Greg Abbott after his decision to halt any further reopening plans in Texas.
And now that the number of coronavirus cases in Texas has more than doubled in the last 2 weeks, the governor has paused elective surgeries in the Austin, Dallas, Houston, and San Antonio areas. The governor is also stopping future customer capacity increases at businesses in Texas. This is a detour from what some have called one of the most aggressive reopening plans in the United States. While he's made it known that another full shutdown would be a last resort, today's decision slows down what had been a phased plan to fully reopen the Texas economy. In Austin, bars and restaurants were shut down for 10 weeks before returning to business just over 1 month ago. And despite recent orders for businesses to require employees and patrons to wear masks, some of those businesses have since chosen to reclose out of either precaution or because employees have tested positive for the virus. But today, as the governor explained, there were far more factors in the rapid increase of COVID-19 in Texas.
Some of this had to do with Memorial Day celebrations. Some of it had to do with graduation celebrations. Some of it had to do with COVID fatigue, where people were just tired of being cooped up inside their houses. Some of it had to do with the perception that, well, COVID wasn't a real concern here in the state of Texas, which at the time, it wasn't a meaningful concern. But now it has begun to spread, and as a result, people are becoming more aware about the necessity to make sure they protect themselves from contracting COVID-19.
The governor also voiced his concerns about hospital capacity as the number of COVID patients rises. It is the same worry that has echoed earlier this week by the members of the Austin Public Health. And we're going to hear from the governor's thoughts on Texas hospitals coming up at the top of the hour.